Hello, my name is Wesley Gowers. I'm a nurse practitioner student at Auburn University, and this is my suture checkoff video. Now, sutures are utilized for hemostasis and wound approximation of tissue wounds that would not heal otherwise. Now, the first thing I will do is explain the procedure to the patient and receive consent. Now, after that, I will perform hand hygiene and cleanse the wound. Now, how I would cleanse the wound is I would use copious amounts of normal saline to flush the wound out so that I could check for depth and length of the wound. I would also be checking for deep vascular injury, tendon, and nerve approximation. Now, some contraindications to suturing include erythema, edema of the wound edges, infection, presence of infection, punctures, animal bites, deep tissue injury, tendon and nerve involvement, and any wounds that are over 12 hours old. Now, once I've cleansed, I've viewed the wound, and I've made sure there's no debris or anything contraindicating suture or stitches, I will then cleanse with chlorhexidine. Now, betadine can be used. However, chlorhexidine is the first line choice for cleansing the wound unless there is a documented allergy. Now, once I cleanse the wound, I will then provide anesthetic for patient pain control and patient comfort. The preferred anesthetic is lidocaine with or without epinephrine. The doses on that are 0.5%, 1%, 2%, with a maximum dose of 5 milligrams per kilogram. I will make sure that once I begin, I will demonstrate the proper technique for anesthetic. Now, sutures come in many sizes, or stitches come in many sizes. Generally the rule is that those sizes, the bigger the number, the smaller the size of stitch. So basically, if like for instance 7-0 is very small, however 0 is big, so you would use a 7-0 on the face, but you would also use a 0 or 2-0 on like the plantar surface of the foot. All right, sutures, our stitches also come in several different materials, absorbable or non-absorbable. The ones I have frequently come in contact with are Vicryl, nylon, and silk. All right, for the purposes of this demonstration, I'm going to be utilizing a Ethelon 4-0 nylon monofilament stitch. Now, once I've cleansed, I've chosen the proper size of material. I will then, once anesthesia has been administered, I will then possibly have to debride or to clean the wound up so that wound approximation can be achieved. Now, to perform the suture, I will need several tools. First of all is good lighting. Second, I'm going to need a sterile suture kit that comes with a mask, sterile gloves, and materials to provide a sterile field. Here you see I have my 4-0 Ethelon sutures. I have my skin forceps, I have a needle driver, and I have scissors if necessary. Now, I do not have a needle or syringe to administer anesthesia with. However, I will just use my needle driver to visualize and to demonstrate how I do that. Now, there are several techniques you can use to place stitches. However, for today's demonstration, I will be performing a 5 interrupted stitch suture technique. So, first thing I've done is I have cleansed the wound, checked the length and the depth, looked for any deep vascular injury, any tendon nerve damage, and I have discerned that suture is appropriate. Now, once this is going to represent my needle and syringe for the anesthesia, the first thing I'm going to do is provide anesthetic. And so what I would do is I would take the needle along the wound edge and I would insert. I would then aspirate to ensure that I was not in any blood vessel, and then I'll pull back slowly. Then I would swap hands. I would then insert on this side of the wound, aspirate, pull back slowly. I'll come to the other side of the wound, insert along the wound edge, aspirate, pull back slowly, swap hands, insert, aspirate, pull back slowly. Okay, now once numbness or anesthesia has been achieved, now I can begin the suture technique. So, obviously this would be done in a sterile field, under sterile conditions. I don't have any of that here. So, now this is a practice pad. However, if this was normal human tissue, I would utilize the halves rule. So, say for instance, the wound was like so. I would go in through the center, through the ends, through the middle, and then applying stitches until the wound has been fully sealed and the edges have been approximated. So but for the purpose of this demonstration, I'm just going to perform 5 interrupted stitches. So the first thing I would do is I take my skin forceps. I'm going to lift the skin up to see the wound edge. I'm then going to go in at a 90-degree angle, which I will come out the other side. Once I see that I've come through the other side, I will pull the line through. Sorry about that. I will then take my needle driver. I will perform a triple surgeon knot. So 1, 2, 3. I'm going to pull the stitch through, applying tension, but not too, just enough to hold the wound edges together, but not enough to cause any damage to the tissues. And since I'm using a 4/0 nylon stitch, I'm going to apply 4 more knots. So over 1, under 2, over 1, and under 2. Now I'm going to pull the knot over, as you can see, to show the stitch, and it'll just make it easier for the person who's going to be removing those stitches to have access to that stitch. So that is my first one. I'll then take my scissors. I'm going to cut the ends off, and I'm going to repeat this process 4 more times. So. Two, 3. Pull it through, light tension, over 1, under 2, over 1, under 2. Pull that over. One, 2, 3. Pull through, light tension, over 1, 2, 3, 4. tension. 1, 2, 3, and 4. Last one. One, 2, 3. 1, 2, 3, 4. All right. So there are my 5 interrupted stitch sutures. All right, now wound edges are approximated. However, on human tissue, if I needed to add any additional stitches, I would. So now that this is complete, following this, I would cleanse with normal saline. I would apply a bacitracin ointment to the site and then cover in a sterile, non-adherent dressing. I would ensure that the patient has had tetanus vaccine appropriately. If not, then I would administer that vaccine. Patient education regarding how long these will stay in. The average is 7 to 10 days. However, on the face, I would probably do 4 to 5 days. And then on high tension areas like the sole of the foot, maybe 10 to 14 days. I'd tell the patient that every day they need to take the dressing off, cleanse with soap and water, and then reapply dressing until they come back for removal. I would also educate the patient on signs and symptoms of infection, such as erythema, tenderness, fever, generalized fever, and then pus coming from the wound. If they do see any of those signs or symptoms, then they need to either come back to us to follow up for stitch removal, or to go to the emergency room to be treated promptly. That is my suture checkoff video, and thank you.